head all the way down to Cheyenne, Wyoming, where Charles Katibi is standing by only today because Charles, some people apparently never learn their lessons. And I would include Governor Meade in that. Am I wrong?
You're not wrong.
Okay.
It includes Governor Meade. I mean, just down the list of the strongest medical lobbyists in this state.
What we're talking about here, once again, is Medicaid expansion. And we've explained it and explained it and explained it to these people and shown them all the charts and graphs. And they are just determined to ram this down their throats. So what was the latest that the governor has done, Charlie?
Well, he came up and he addressed the legislature at the beginning of the budget session on Monday. And in his State of the State, most of his attention, all of his focus was on we need to expand Medicaid. And the point he was making was that all these hospitals that we have are drowning in bad debt and charity care, all this care that isn't being paid for. They're going out of business. And what we need to do is expand Medicaid, which will bring them back to solvency.
Did anybody bother to explain to the governor that part of the reason that some of these are going out of business might just be because of Medicaid?
It is. And I made that very point when I testified to the Joint Appropriations Committee. And they heard and listened. And then afterwards, Representative Tim Stubson of Casper, he made a motion to strip Governor Meade's proposal to expand Medicaid in the budget. It was stripped out. And afterwards, now in the State of the State, he said, I disapprove of the Joint Appropriations Committee's decision, and I want you to add it back through a budget amendment.
And just real quick, is that going to happen?
I am very, 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 very doubtful of that happening. Okay. This has been the fourth year where they'll have a chance to vote on this, and I just don't see any point. I don't see any chance. The facts have come in, the costs have exploded. It's just not a great deal.
There's several stories. There's one on my website today, in fact, about exploding costs under this. But let's stick with the state of Wyoming because, I'm just saying the evidence mounts and just continues to mount. But this governor just keeps pushing. So didn't he just recently go to some kind of a conference or something like that?
He went to, so after his State of the State address, a mere 3 or 4 hours later, he went to the United Presbyterian Church in Cheyenne, Wyoming. And he joined Healthy Wyoming, which is a coalition of some of the most powerful medical lobbyists, associations in the state and the country. Right. This includes the Chamber of Commerce, the American Heart Association, AARP, United Steelworkers, the Hospital Association, everyone. And here he made the religious case for expanding Medicaid as well. Yeah.
All right. Well, at this point, anything, because if you don't agree with expanding Medicaid, Charlie, you're going to hell. You understand that?
Look, at this point, he's just throwing everything at the wall and seeing what sticks. Yeah. He's made the case that this will save hospitals money. No, hospitals in other states are no better off. Right. And in a lot of cases, they actually do worse. In Kentucky, after they expanded Medicaid, hospitals across the state have been shedding thousands of jobs because the reimbursement rates have been cut. They're shutting wards and clinics. And that's just one argument he's been making. He's also made the argument that it'll get people covered and give them better care. That's not correct either. I mean, the list just goes on. And then he appealed to people's faith, which was, just the bottom of the barrel at that point.
Well, at this point, I don't understand why he's not listening. But then again, you and I have both spoken to people, and right to their faces, giving them this kind of information, and they just choose to ignore it for whatever reason. So I'm not going to get all psychological on the governor here to figure out why he's just refusing to see this. And here, this is the stuff that I can say, Charlie, but I don't know if you necessarily can. This once again shows that for all those people who voted for Matt Meade for governor, you thought you were getting a conservative Republican. Obviously, you weren't. You got to be very careful. Just because there's an R by somebody's name, and that goes for the presidential election, too, when it comes to healthcare. Just because there's an R by somebody's name doesn't mean that they're a conservative. So besides appealing to God, is there anything else that the governor is trying to do to get this passed? Because I know there's a lot of behind the scenes tricks involved.
He's made the case. He's made the case that this, and this is one of the more compelling cases on the surface, and I cannot stress that enough. He's gone beyond saying, because before the case was that people needed care and Medicaid would provide the care, as well as that it would make hospitals a little bit more solvent. Now, with our budget crisis, he's saying that it will save the state money, which just shows just how many arguments you'll run through just to see if anything sticks. And in that argument alone, that's also completely false. Now, he's made the case that expanding Medicaid will save the Department of Health about $9 to $10 million. And the way how he's saying we'll do that is by reducing the amount of involuntary hospitalizations we provide. Now, what that is, for any of your viewers out there, is if somebody is deemed to be a threat to themselves or others, if they're mentally unstable or have a drug problem, authorities will involuntarily contain them and send them to a hospital to be psychiatrically treated. And what Matt Mead is saying, and the Department of Health are saying, is that if we expand Medicaid, somehow these costs will go down. And I was a little interested in that theory, so I did a little digging, and it turns out Medicaid cannot pay for involuntary treatments. And the reason why is because under federal law, the federal government will not allow Medicaid to pay for involuntary hospitalizations. And that is because the federal government does not want to be on the hook for the psychiatric costs, because they feel that is a state's responsibility. Yet Matt Mead is going around, and Healthy Wyoming is going around, saying that somehow Medicaid expansion will save the state money, when it is against the law to do what Matt Mead is saying.
Yeah. Okay. Now, well, again, they're just pulling out all the stops, including "you will go to hell" because we were in a Presbyterian church. Therefore,
exactly.
So, all right. How many people in this Healthy Wyoming and other such groups? Do you know how many people this actually represents?
I don't know how many people. It is at least three dozen large associations. There's the Nurses Association, the Medical Society, the Hospital Association, the Education Association, the Business Alliance. This isn't just medical associations that have come behind it. Just the Chamber of Commerce, United Steelworkers. It's a very interesting, eclectic group that they've.
Well, it sounds to me like political favors are being pulled in for something like that. That's just a theory, but but what they won't mention is all of the different medical associations and other groups that are against it, because there's plenty out there, including hospitals, that are standing up against it.
Yeah, Sheridan Memorial, the Memorial Hospital in Sheridan has come out against this. And a lot of times, a lot of other hospitals and particularly private practices, they're afraid of speaking against Medicaid and Medicare and the federal government because they're the ones that sign their paychecks. And if you're going to say, look, we have all this support behind us and there's nobody against us, I mean, you really have to think, I mean, you're going against the federal government. Do you really think you're going to get an onslaught of just average physicians or average medical practitioners to come storming at the gates of the federal government, especially when they're signing their paychecks?
Yeah. So, right. So there's where the opposition has incentive to shut up, and then you don't know that they're out there because it could cost them, well, their practices, their businesses, their careers if they stand up to something like this. So what about behind the scenes parliamentary tricks, for lack of a better way? Because last time you and I spoke about this, the governor was trying to attach it to anything you can think of and pull in a bunch of committee tricks to get this on.
So as you remember, for the past few years, the supporters of Medicaid expansion, which weren't always with Governor Matt Mead, he was a little undecided at first, they always tried to send it through the normal budget process or through the department or through the Health and Labor Committee, because that's where most of the medical bills come through. That didn't work. Then, this time, they tried to send it through a sneaky way and tried to get the support of the Joint Appropriations Committee, because we're going through a budget crisis. And they said, why don't we attach it to the governor's proposed budget and say that it will be a budget saver? And if you look at the governor's budget proposal, as well as the Department of Health's budget proposal, if you just look at the numbers and didn't do any digging, it does say that we would save $9 to $10 million. But as I said before, there was no way for that to actually happen.
No. Well, you can rig the numbers in all sorts of different ways on paper to make it look like you would save that kind of money. You and I both know that in reality, kind of like Obamacare, they rigged the numbers on paper to make it look like it was going to save us $1 trillion a year. So it's always possible to rig the numbers.
Yeah. And it begs the question, even if we did expand Medicaid, do you think we would not go back and ask them, what was all this nonsense you were talking about? All these promises of solvent hospitals and people getting care and saving the state money. It was this at this point. It's just truly an act of desperation what the governor and all these medical associations are trying to do. But anyways, that is the path that they thought the path of least resistance was to appeal to people's fiscal conservatism and say, in this time of tight budgets, this will save money. And they tried to send it through. And after hearing the case of the people that were for it and the people that are against it, which included me, they said there is no way in which this will save money or even help patients. And they stripped it out.
Here's just a thought. Hey, go ahead and pitch this. And if anyone looks at you like you're insane, just tell them it was my idea. That way you're off the hook.
Well,
and then laugh. Just, you just wanted to see how it went over. So if the House and the Senate in the state of Wyoming just simply wrote a one-page note and passed it to the governor. Dear Governor Mead, regarding Medicaid expansion, no.
I'm sure he's received plenty of those emails from his fellow legislators because they realize that the math just doesn't work on his proposal. So after he failed to send it through, sneak it through the Joint Appropriations Committee, now he's got to do the hard slog. He has to convince all our senators and House reps that, and these are the same ones that have rejected it year in and year out, that this time he really means it. This time it will save the state money, it will get people covered, and it will make our hospitals more financially sustainable.
Oh, yeah. He really means it this time. Okay, well, here's what Charlie and I are going to be talking about next. Okay? And Charlie, I'm really looking forward to this conversation right after the commercial break here. Hey, folks, apparently somebody wanted to do a study about single-payer socialist medicine in the state of Wyoming. And we'll find out if taxpayer money was used for that study. Just a moment. And back we go to Cheyenne, Wyoming. Charles Katibi sitting by, I assume, on the phone. And we're talking about the idea of a single-payer healthcare system in the state of Wyoming. And so first off, let's clear this up. It's called either socialist medicine or socialized medicine or universal healthcare or single-payer healthcare, which is all the same thing, just to clear that up. So who decided this would be a great idea?
This was actually recommended by Representative Harshman, who's the chairman of the Joint Budget Appropriations Committee. The same committee that threw out Medicaid expansion, and he wanted to commission he proposed commissioning a study that would look into what the viability of allowing employers and individuals to buy into the public employee health care.
Okay, so this is not like universal socialist medicine that everybody is forced into.
No, it wouldn't. It wouldn't. But it would essentially be the same. The idea that the people would be able to buy into this government-run plan that would pay. It wouldn't take over the hospitals, but it would pay all your medical bills, and like it works. And if we're looking at state employee plans, they have very low deductibles and next to no premiums. And if you're thinking about, what will that do to the cost of medical care? A lot. Because if you lower the cost of something, people are just going to use a lot more of it.
Especially, and think about this, the taxpayers will end up having to pick up the bill for this. So those people, let's take a look at how this would happen if they actually did it.
Sure.
So you decide that you're going to go ahead and sign up for this. So are your premiums the actual cost of the services, or are you being subsidized by the government, which is what's happening to state employees?
Well, that's always, whenever the government is going to offer a service to somebody, you're never ever going to pay the full price of it.
So if you got sick, then I'm going to end up paying your medical bills, or part of it anyway, as a taxpayer.
Absolutely.
Even though I'm not involved in the system.
Of course not.
Okay.
Gotcha. Because taxes have to come from somewhere. Right. And they come from entrepreneurs and just regular taxpayers, individuals. Mm-hmm. Yeah. Any plan, like any government-run health insurance fund, is never going to actuarially set premiums and deductibles correctly, because that's what private insurance is for. Right. And if you think the cost of private insurance is too high, that's why you set up a government-run insurance system, so people will pay less.
Hey, I'm going to go out on a limb here on something like this. So we wind up, if we did something like this with the state income tax, we would have to in order to pay for this.
Are you kidding? The state of Vermont, which isn't known for being a very fiscally conservative state, they actually took a look into what it would cost to set up a single-payer healthcare system. Yeah. And the governor was all on board. He was a Democrat. This is Bernie Sanders' state of all places. They commissioned a study, and they found out that it would have cost $2.7 billion to institute it. Now, to put that into perspective, the state of Vermont every year collects around that much already. So they would have
their whole state budget for the year.
Yes. So they would have to double the size of the state budget and double all the revenue that they're extracting from businesses and individuals to pay for it.
Now, I remember after this was shot down in Vermont, and even the governor, very disappointed, said that, well, even though he ran his campaign that he was going to do this, he ended up not doing this. There were protesters out in front of the Capitol because they wanted this, even though it was shown to them that they weren't going to be able to afford it, but they wanted all of this free stuff. In fact, Vermont even asked the federal government if they would chip in and help them pay for it. The feds said no. So this guy, he wanted to do a study in the state of Wyoming. Are we going to do the study?
I don't know if they will, actually. This was just a discussion. I'll have to get back to you in your audience.
The reason I asked that is a lot of times cities, counties, states, even the federal government will go ahead and do a study, even though they know full well they're never going to do it, but they'll go ahead and spend millions of dollars in some kind of a study. So that's what worries me.
This is what worries me, though, because right now the cost of medical care is extremely expensive. It was always like this, but it's really escalated and picked up steam.
That's not possible. No, you're lying. We have the Affordable Care Act. Everything's cheaper.
Sorry. Okay. How cruel of me. How could I? It's the Affordable Care Act of all. No. All right. Anyway, back to reality. Yeah. So that the costs have just escalated even more, and a lot of people thought and bought into the idea that Medicaid expansion will be our savior. Yeah. And thankfully, it doesn't look like it's becoming a reality. So what they're looking at is any sort of alternative, and that's what this is.
Where do people follow your work as you write about all of this?
They can go to wrliberty.org.
Charles, thanks for coming on. Appreciate it.